Hey, good morning, everyone. Scary here. Hey, if you're new to my channel, welcome. If you're coming back to see me again, welcome back. Today's subject is going to be a little bit about medical white lies. I'm going to start out the program by saying people that have been watching the past few episodes of mine, they're noticing that I have a facial paralysis in the right side of my face. It's called Bell's palsy. And I want to talk a little bit about that today. That's going to be a subject that I'm going to talk a little bit about in the beginning of this show. The optometrist, the eye doctor will tell you. So this side basically is growing back. It's doing a lot better. The last thing to get better is the eyelid. Now the eyelid does not voluntarily close up and down by itself like the left side does. The right side's starting to. But in the early stages of Bell's palsy, it wouldn't shut. So at nighttime when you're sleeping, the optometrist tells you you gotta tape your eyelids shut at night. They tell you that you have to get it done, but they don't physically show you because then they become liable. This is the shit they tell you to use. This is that. It's white, that white clear tape. It's kind of clear. And it's sticky, it's gluey. That shit. I'm going to take a piece of it off right now so you can see what I'm talking about. See what I mean? You can see through it. Well, they tell you to they tell you to pull your eyelid down, put a piece up here and glue it to your face. They don't show you because then they're liable. They tell you. And then they send you on your merry way. So how did I learn how to do it? I went on YouTube and I typed in how to tape your eyelids shut with Bell's palsy. And there's people that are patients showing me how to do it. They're showing me because they had to learn by trial and error on their own. And they can't be held liable because they're the actual patients going through it. See, the doctors aren't going to physically show you because if they fuck up by showing you, then you can take them to court and sue them. I'm not the suing type. I'm just not. But there are people out there that make a living suing people, like doctors. So I had a shot at that. I've been doing that. So this whole side of my cheek is gluey right now. Because the only way to get the shit off, so in the morning, the only way to get the fucking tape off your face is you got to take a hot shower. I did not know that. They said, oh, you got to take a hot shower to loosen up the fucking adhesive on the tape. The first time I tried to do it, I tried to peel it off your skin. The most sensitive skin next to your nutsack skin, or your vulva skin for women, is the eyelid. Try peeling off some tape off your eyelid. It hurts like a mofo. So just by trial and error and looking at YouTube stations and how-tos, you got to take a hot shower, put a warm compress on it to get that glue off. Well, it didn't all come off. It's still gluey. It'll be like that all day. Which brings me to my next subject. About misdirection and white lies in medical community. I wasn't always ate up like this. I wasn't. People have been saying to me my whole life from age 25 through now, why I operate the way I operate. Why I tell it like it is. I don't lie to people. When they ask me how something is, I tell them the truth. I tell them what's on my mind. And people would say that. Well, why, people would say, if you don't want to know what Gary's thinking, don't ask him. I tell it like I see it. Which brings me back to when I was 24 years old. When I was 24 years old, I had a big old lump on the fucking left side of my fucking neck. You know when you're sick with a cold, your glands swell up? They get hard, they swell up. Because your major glands in your body are your neck, under your armpits, and in your groin. Those are the three regions of your body where your largest lymph nodes are that swallow up infections in your body. That's why you can feel it on your neck when you get a cold. I know I'm talking fast because there's a lot of content here and I want to get it all into something less than 15 minutes. So that said, I had a big growth here and it got bigger and bigger and bigger and bigger to a point where my mother looked at it I had my own apartment and I went home one night. I called my mom one night. I said, Mom, my neck is really starting to bother me. Up until that point, 3 or 4 weeks up until that point, I was going to see my family doctor, my parents' family doctor, and they kept on giving me antibiotics more antibiotics. And the doctor at the time, he was an older guy, goes, oh, we'll give you some more antibiotics. We'll make him stronger, stronger, and stronger. Meanwhile, he didn't know what the fuck he was looking at. He didn't know how to fucking handle it. He didn't know. He just didn't know. So then one day it started to hurt. One night, I called my mom. She goes, let me call my ear, nose, and throat guy, ENT. Went to see him. He took one look at it. Didn't even touch it. He took one look at the mass on my neck and said, we're going to do a biopsy on that. I need you to be at this hospital tomorrow morning at 8 o'clock sharp. They went in and did a biopsy. They came back. It was malignant. I had Hodgkin's disease, which is cancer of the lymph node glands. Yeah, that's what I had at age 24. That's when I started to become a realist, speaking from the real world, because I was going through it. So the first 3 months was just nothing but test, and more tests. They were prodding and sticking me and doing CAT scans, MRIs, jamming full of needles and filling my body with dye and taking pictures of it. They wanted to find out where the cancer was, how much cancer was in my body, and where was it? Was it just here? Was it just above the neck, or was it all over? They did all kinds of tests. The tests were very they were draining, to say, for lack of a better word, they drained the fuck out of me, okay? So then they get to the point where, okay, we'll figure it's all over. He's got it in his legs too. He's got it in his arms, got it in his torso. He's got it all over. So we're going to have to give you chemotherapy instead of radiation. I didn't know what was going on. I was just going along with the crowd, doing what the doctor said, right? Doing what the doctor said. My parents were doing what the doctor said. So they gave me chemotherapy. I went through that for a fucking year. In that time, the first time I had my chemotherapy, the first time they injected that shit into my veins, my mind and my psyche, my whole body, we didn't know what to expect. This is where the human mind is so powerful. It didn't know what to expect, so they jammed my fucking arm full of fucking poison, chemotherapy, poison. What does chemotherapy do? It kills all the good cells. It kills all the cancerous cells, but because they don't know how to completely perfect it, it kills the bad cells and the good cells. That's why chemotherapy patients look like shit. They lose all their fucking hair. That's what I did. I lost all my hair. I was bald. Your eyes are sunken in your head. You're pale. You look like you're 2 steps from the graveyard, because chemotherapy gets you within inches of death to kill all the cancer cells. Because that's all they know. I don't know how far modern medicine has come, because it's 2026, but that was in 1984, and that's the best they could do in 1984. So I know what it feels like to be almost dead, because they got me close. So 2 weeks out of the month, I had chemotherapy. The last 2 weeks of the month, I was off. I got the rest. Well, it wasn't really rest. It was recuperating. My body going, what the fuck just happened those first 2 weeks? And you're the whole year's a blur. The whole fucking year's a blur. So the second time they come calling for that fucking injection, this is where the human brain is so smart. The second time they come for that injection, the brain knows what's coming. And I start shaking. My whole body starts shaking uncontrollably. So where they had to give me an injection in the ass, some kind of a drug to calm my ass down. And even after they gave me the shot in the ass to calm my ass down, the brain knows what's coming. It knows what's coming. Have you ever been so sick? People out there who may have cancer. Because see, when I'm talking on the show, I'm talking to a lot of people. I'm talking to a mass of people in the world. If there's people out there that are going through chemo, listen up, because I'm telling it how it is. All right? Have you ever been so sick on alcohol or just being sick with the flu where you have the dry heaves? The dry heaves, you know what they are, where you can't puke anymore, so you just puke and just to puke. You're puking up air, and any mucus is left in your fucking body. It dry heaves. That's what happens after you have chemo. You go home and you sleep for like a half an hour. Then you wake up violently ill for 3-4 hours. Solid, nothing but puking. Dry heaves, dry heaves, dry heaves. Oh yeah, it's a party. It's a party. It's a fucking party. All right, that said, so they kill. We've already said it kills the good cells and the bad cells. But the bad cells, to get to the bad cells, they got to kill the good cells too. After chemo, I was going into clinical remission after 1 year. The doctor comes into the office. My mother and father are there. They're flanking me, and I'm in the center in the desk. And the doctor says to me and my parents, these are a list of all the side effects you might get going down the road the rest of your life. You might get warts on your hands or your face. I got them on my hands. You can see them. They're on my hands. You look at my hands. I only got them on one hand. My left hand I don't have. My right hand I got them. I got them actually on my left hand too. This one here. See that on my thumb? I didn't get them on my face. Thank God, because I got them on my hands. I'd take them on my hand before I got them on my face. Can you imagine? You'll get shingles throughout your life occasionally. I only got it once. Thank God. That's all I needed to get it was once. You'll have rashes. I had all the side effects early on through my 20s. Every side effect they said, you may get these side effects. You may, but you may not. But you may or you may not. They are trained to say you may get these side effects for liability reasons. Just going back to the optometrist with the fucking tape. It's a liability thing. If they say you will get these side effects, then they're setting themselves up. Or if they say you may, if you're saying you may get these side effects and you do, then they're not liable. But if they say it's a good possibility you will get these side effects and you get them, they're still not liable. Because they don't know. If that made any sense, I'm trying to make sense of this. They don't know. So they gave me a list of 8 side effects that I might get the first year or 2. You may get them. You may. I got them all. I got them all. And that tells me that if I got them all, everyone else out there that was getting chemotherapy was getting all of them. They had to say you may get them so they aren't held liable. So they aren't setting themselves up for a lawsuit. What they didn't tell me, and I had to research this on my own, the long-term side effects throughout my life. Tissue issues, tendon issues, nerve damage. Little stuff. Bone issues. Back issues. Joint issues. I've had them all. And I'm still here to talk about it. I've had them all. Which brings me to my next subject. 3.5 years ago, I had a total left knee replacement. Why? Because the kind of work I did, standing on concrete floors for 36 years in cold conditions, and all the heavy lifting I had to do. But a lot of people get knee replacements. Tons of people get knee replacements in the world. All right? Modern medicine made it so that they perfected it where they could do it. My knee's never been the same. Is it better than what it was before I had the knee surgery? Yes. Because before I had the knee surgery, I was fucking bone on bone. Bone on bone. But before I go into the knee replacement, I want to step back. I know I'm all over the place. I got a lot of content here. After I got cured from cancer, the hospital, I'm not going to name it because Cincinnati is one of the biggest, smallest, big town, one of the biggest cities in the world where everyone knows everybody. It's a small town, really. So I'm not going to say the name of the hospital. They had a program called Cancer Patients Helping Cancer Patients. And I volunteered for that program. I said, oh yeah. I'll spend a day or two a week at the hospital talking to patients that are going through what I went through. After 3 weeks of that, they asked me not to come back. Why, you ask? Well, if you watch my program, you'll know why. because I don't give a fuck. I tell it like it is. I speak from the real fucking world. So I was going in there at age 25, and I was sitting there with parents and patients that were getting ready to go through chemotherapy or were in the process of getting the chemotherapy, and they wanted to hear from people that been there. Well, everyone that was there, they were lying to them. All these other patients were saying, oh, it'll be okay. They were massaging them. Oh, it'll be okay. You know, you won't get that side effect. No, you'll be fine. Bullshit. Gary opened his mouth. So, well, you're going to get this. You're going to get this. Have you been sick yet? Okay, well, you're going to have violent dry heaves for about 3.5 hours. Did you have this? Did you have this? Did you have that lymphangiogram where they jam needles into your fucking toes and send dye up your legs and take imaging? Did you have that yet? Oh, well, they'll lie to you because that shot, and when they stick that needle between your toes, it hurts like a motherfucker. And then the parents are going, oh my God, he's saying that about my son, my daughters. He's freaking my son and my daughter out for her because they haven't had yet. I was telling it like it was. And the people that were doing the program of this cancer patients, helping cancer patients, these people were doctors or interns learning to be a doctor, and they asked me nicely not to come back. And I asked them why. I said, why can't I come back and talk to the, well, because we don't want them. You're freaking these people out. We don't want to freak them out. Why? So you can fucking lie to them? Don't you want someone like me here? I don't have to fucking be here. I'm here because I want to tell it like it is, fuckers. I want to tell these patients what they're going to be expecting in the next couple of years. But they didn't want me to come around, see, because I'm a realist. I had to learn the hard way. I was deceived, is the best way I could say it. I was deceived for a solid year through chemotherapy. Every test I had, because I had a ton of tests. Every test I had a different doctor. And that doctor said, you may have this happen to you. This might be a side effect. This might be the way your body reacts. This may. See, that's the word, it may happen. So they aren't liable. See. And it's not their fault, really. Because what happened? The doctors had to learn from someone else who was a doctor. Doctors are just a practice of medicine. See, that's the word. Medical doctors are the practice of medicine. That's the word, the practice of medicine. So they went through med school and they're being taught by a professor that was actually a doctor. And he didn't want to be a doctor anymore, so he decided to be a professor, a teacher. And they're learning from so it's generation after generation after generation after generation of doctors that are experiencing what things may or may not happen to a said patient, and they're telling their students that. So it's really not their fault. But somewhere along the line, there's a doctor or there's a class in med school. They say, well, you gotta use these adjectives. You gotta say it may happen. But not all people get it. Not all people experience it. Why? You gotta cover your ass, people, because you don't want to be sued. You know it happens. That's called the medical white lie. Tell you what you want to hear. Tell you what you want to hear. That's why I am the way I am today. When they told me not to come back to that show, not that show, when they told me not to come back to that class for cancer patients, helping cancer patients, that's when I got really sour. It took me a couple of years to really reel it in, to not be so bitter. My first year out of chemotherapy, I was a motherfucker. It's something that happens to people, and you got to just deal with it. I'm not bitter. I became a better person for it. I grew up really fast. And I became one of these types of people that tells it like it is, because I was lied to. So when I go to a dentist now and they say, well, that molar looks like it might have a little bit of decay on it, but we're not sure if we're going to work. I'd say, I tell them to get their hands out of my mouth. Hey, I'll take my chances. Thanks for your advice. I'll take my chances. They want to drill. Why? Because they make money drilling. See? Well, we're going to do an x-ray on your mouth. Well, no. You had x-rays on my teeth the last time I was here. You're not giving me any more radiation. Thank you very much. No. We have the power of choice in this life. If you think something's rotten in Denmark, say no. No, I don't want that injection. No, I don't want that examination. And certainly I don't want to have that cavity filled. No, I don't need x-rays again. You did x-rays last time. No. Every test they do, they make fucking money for the hospital. And I'm going to end the show right now because I don't want these things to go long, and this is going long. It's 20 minutes. God damn it. I don't want to go that long. I'm going to tell you right now, when COVID was around, every single doctor in America was told by their bosses to tell every patient that they came into contact with, did you get your shot? They were told to tell them that because the hospitals made money. That's all I'm going to say about COVID. That's all I'm going to say. All right? Keep your eyes open, people. Make your own decisions in life. And when it comes to medical practice, make your own decisions in life. I'm speaking from the real world, what happened to me. I came out a better person. I came out cured. If I didn't do the chemotherapy when I was 24 years old, I wouldn't be here right now. So it did, in fact, save my life. But I'm just saying, going forward, don't let them prod and poke you unless it's absolutely, positively fucking necessary. Because they are trained to give you the medical white lie. It's their job. That's all I got, people. I'm out of here. Sorry, this was a little bit more serious than the other ones. I got other contents. It's going to be more talking about what I used to do for cutting meat. I got some good stories there. I'm going to share those later on in the week. You all have a fantastic day. Take care of yourselves and each other. Take care of yourselves and each other. Really. Peace out.